semester, I'm a pharmacy technician student, and this is my ISMP video on a medication error. So in the ISMP article that I chose to look at, there was a dose error with methadone. So a patient had recently given birth to a baby and was brought to the hospital to be monitored. Now, she was a patient who was using methadone for opioid use disorder, and so she was taking it every day. So when she was in the hospital, she was given her first dose of methadone, which should have been 85 milligrams, but she was instead given a 10-fold increase, and she was given 850 milligrams. Now, she became sedated, and the nurses quickly noticed something was wrong, so they gave her an IV dose of naloxone. She still didn't respond to that, so she was actually moved to the ICU where she was given an infusion of naloxone. Now, even though the patient recovered, there was still some missed bonding time with her newborn baby, as well as she couldn't breastfeed because the concentration of the methadone in the breast milk was too high. Although the patient and the baby ended up recovering, this was still an event that had negative implications. The patient and the baby had to stay in the hospital for much longer than they had anticipated. As well, the mother's methadone dose was stopped until she had withdrawal symptoms, which meant the methadone concentration in her body had decreased, and so then they started her back up on a lower dose. The patient was given a 10-fold increase in their dose because the hospital had recently switched over from carrying a 1 milligram per mil solution of methadone to a 10 milligram per mil solution of methadone. Now, this is the root cause of the incident, as the healthcare providers were unaware that the hospital had switched over the concentration of the methadone. They continued dosing as if they were using the 1 milligram per mil solution, when in reality they were using the 10 milligram per mil solution. And this is due to complacency in not reading the labels and the warnings and the letters that were sent out, which informed them of the change in the concentration. So although the bottle was properly labeled and there had been communication with the healthcare providers within the hospital about the change in the concentration of methadone, this error still occurred, which makes it seem as though maybe the healthcare providers were too busy to acknowledge the labels and the warnings, or they were just complacent and thought things never would change. Another reason this may have happened was because the healthcare provider did not have someone else do an independent double check of the dose that they were going to be giving the patient. ISMP recommended that methadone should be dispensed as a patient-specific unit dose instead of ward stock, where a nurse would need to draw up the proper dose based on their calculations. ISMP also reiterates that hospitals should only keep one concentration of methadone solution on hand to avoid confusion. They also suggest that an independent double check be done before administering a dose to a patient, and to communicate a patient's dose of methadone in milligrams and not milliliters. Based on personal experience, as well as what we've learned in lab and class, I would also implement some kind of acknowledgement for any healthcare providers working in the hospital who dispense medication for them to read and sign. And this could be part of an ADU, where if a healthcare provider is trying to retrieve a medication where the concentration or strength of the drug has changed, that a pop-up will appear and they will have to initial and acknowledge that they are aware that the strength of the medication has changed. I would also implement a change where only measuring tools that are appropriate for the concentration of the drug being dispensed are available. So for example, if we carry 10 milligram per mil strength methadone, we would only have a 10 milliliter syringe available for measuring. This way, it might flag something for the healthcare professional. They might realize that a dose could be reasonable or not. Thanks for watching.